Rinse takes your laundry and hand-delivers it to your door, expertly cleaned and folded. So you could take the time once spent folding and sorting and waiting to finally pursue a whole new version of you. Like Tea Time You. Or this Tea Time You. Or even this Tea Time You.
Said you hear about Dave?
Or even Tea Time You.
So update on Dave.
It's up to you. We'll take the laundry. Rinse. It's time to be great.
When it comes to what your family eats and drinks, you know your choices matter. You're the expert because you know what fits your life. And getting it right starts with good information. That's why America's beverage companies are sharing more information about our ingredients at goodtoknowfacts.org. No spin, no judgments, just the facts straight from the experts for more than 140 beverage ingredients. Visit goodtoknowfacts.org.
Well, hello there. I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes that I release on Thursdays. So today, this one is probably more geared towards student nurses, and we're going to be talking about highlighting. Now, I know nurses and nursing students love their highlighters, but if your notes look like you're just highlighting everything, guess what? You know, I know that is not especially helpful. If your notes look like a unicorn died all over it, that is not helpful when there is no rhyme or reason to using different colors. So today, and I swear I've talked about this before on the podcast, maybe I have, it bears repeating because it is so helpful. And that is a simple system for utilizing color coding that really does make a lot of sense for nursing school. And if you're not a student in school, but you're a nurse and you're learning about different disease conditions, guess what? You can use this color coding system for that as well, if that is your jam. So what I like to do is basically divide things into clear categories and some basic categories, and you can choose your own, but this is how I like to do it. A category for pathophysiology related things. Medications is another category. Lab values, things like that is another category. In school, I had a category for numerical measurements because you had to be so specific and know like what size Foley catheter for this type of patient, what size needle, etc. So I would have one for that. I would have a category for signs and symptoms of different disease conditions. And of course, each category is a different color. So let's just talk briefly through how this might look for you so you can use the system too. So again, a key category is pathophysiology. Let's say that's yellow, and this would be your disease processes. And I'm not saying highlight the entire paragraph in your textbook or in your notes about the pathophys, but the key things that you need to know that can trigger your memory so that I understand how asthma works, or, oh yeah, I remember now how kidney failure works, or whatever it is. So yellow is a great color for that because it is very all-encompassing. It's like the classic highlighter color, and it is very bright and attention-getting. So you might want to use yellow for pathophysiology. And then for medications, let's say you're using pink for that. Anything drug-related would be pink. This would be the name of the drug, the dose of the drug, the side effects, the contraindications, all those key things to know about different medications. And then lab values. Definitely you want to make sure that you're understanding lab values as they relate to your patient's disease condition. Let's say you decide blue is the color for that. All your lab values, your diagnostic test ranges, critical labs, all of that stuff you're going to highlight in blue. And then signs and symptoms. Let's say that's going to be like orange, for example. And signs and symptoms would be the key Well, the key signs and symptoms for your disease condition. So let's say, for example, that it's pneumonia. You would highlight in orange that, the patient may have a cough, they may have a fever, they would maybe have a low SpO2, they could have consolidation in their lower lung fields on that chest x-ray. So the different things that you would be looking for in your patient with pneumonia. And let's say you're using orange for that. And then green could be what you're using for nursing interventions. And when I think of green, I think of go and do this thing, right? So this is where you're stepping in as a nurse for your patient and doing interventions. This could be your positioning, your application of oxygen, your mobilizing the patient, repositioning the patient, changing dressings, inserting NG tubes, whatever it is. All the nursey things that you're doing at the bedside could be green, for example. So what I really love about this system is, yes, it is colorful, but it's not, like I said, like a unicorn just exploded all over your notes. It is very systematic. And when you go back and review your notes, you automatically know, like, let's say you're looking for some information related to the signs and symptoms of a disease condition. Well, then I'm scanning this area for things that are in orange, and it makes it easy for you to find things. It also makes it easier for you to recall information for exams or when you're at the bedside, because you can almost kind of see it in your mind because you already know what color it is, right? Let's say it's a pharmacology thing and you've chosen pink for pharmacology. Then it's a little bit easier for your brain to pull that information up because you already have one solid thing about it, and that's that it was pink. And it makes it easier for you to kind of picture that in your notes. It's highlighted in pink. It's about furosemide, for example. And so color coding, again, great for recall as well as quickly identifying things in your notes. So next time you're highlighting, resist the urge to highlight everything. Okay, and try a system where you choose different categories, and the ones I mentioned make the most sense to me, but maybe there's something else that makes sense to you. Commit to using specific colors for specific categories. Keep those highlighters with you at all times in a little pencil case, and you will always be able to keep your notes in your text and in your handwritten notes, and even in the notes on your computer. You can highlight on your computer in different colors. You can keep everything consistent and very, very organized. I hope this tip helps you, and I will see you again soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com, and for more nursing-related content, go to straightanursingstudent.com.
Doug. Here we have the Limu Emu in its natural habitat, helping people customize their car insurance and save hundreds with Liberty Mutual. Fascinating. It's accompanied by his natural ally, Doug.
Limu, is that guy with the binoculars watching us?
Cut the camera. They see us.
Only pay for what you need at libertymutual.com.
Liberty, 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 liberty.
Savings vary. Underwritten by Liberty Mutual Insurance Company and affiliates. Excludes Massachusetts.